Testosterone cypionate is a single large ester-based testosterone compound and is one of the most popular testosterone compounds on the market. Testosterone cypionate first appeared in the 1950s under the Upjohn label Depot Testosterone and is largely considered the dominating testosterone on the U.S. market. It is without question one of the most, if not the most commonly prescribed injectable testosterone in the U.S. for the treatment of low testosterone. As a large ester-based compound, testosterone cypionate does not carry a need for frequent injections. Therapeutic settings normally call for one injection every 10 to 14 days. However, in some cases this may stretch out to 21 days depending on the precise purpose of use. In a performance-enhancing setting, testosterone cypionate is normally injected 1 to 2 times per week. An important note, testosterone cypionate is very similar to testosterone enanthate, the dominating testosterone on the world market due to its availability. There has been, however, a long-standing argument among many performance athletes as to which form is better. And the answer is simple, they're both right. These two testosterone compounds are virtually identical in every way. One is not more potent than the other. One will not promote less side effects and the total mode of action is the same. In either case, these are two primary testosterone compounds. Both are highly effective and well tolerated by most adult men. The primary medical use of testosterone cypionate is to treat androgen deficiencies. The treatment of low testosterone is the most common. Your body is no longer producing enough testosterone on its own to meet its needs. Introduce testosterone cypionate and the problem is solved. Granted, this is a synthetic form of the naturally produced primary male androgen, but it's still merely testosterone. It has also been used in the past to treat muscle wasting conditions, osteoporosis, vaginal bleeding, and treating metastatic breast cancer. However, currently androgen deficiency is the only primary cause of medicinal use, with metastatic breast cancer being somewhat of a rare point of use. Testosterone cypionate is no longer used for the other ailments. Then we have performance enhancement, and it is here we find testosterone cypionate to be one of the most valuable anabolic steroids of all. Highly versatile and very well tolerated by most men, this is a perfect steroid for nearly any cycle or level of use. By its natural mode of action, supraphysiological doses will enhance protein synthesis and nitrogen retention, increase red blood cell count and IGF-1 output, as well as inhibit glucocorticoid hormones. All of this combined promotes an enhanced anabolic atmosphere, an enhanced metabolism, and the perfect environment for any related performance goal. For the all-season bulking cycle, this steroid will greatly promote mass and strength, and it will allow such gains to be made with less body fat accumulation that would otherwise occur. For the cutting cycle, testosterone cypionate will greatly preserve and protect lean muscle mass and enhance the efficiency of the desired fat loss. Regardless of the purpose of use, all who supplement with testosterone cypionate will find their muscular endurance increases as well as their overall rate of recovery enhanced. Not only do we not tire out as fast, we now have the ability to heal faster so that more work can be done. When it comes to the performance traits of testosterone cypionate, the enhancement of endurance and recovery are invaluable. The side effects of testosterone cypionate largely revolve around estrogen, its androgenic nature, and cholesterol. For the individual suffering from low testosterone, there is rarely an issue. After all, in such cases you are merely replacing what the body is lacking. Side effects are still possible, but where they will be the most prevalent is with supraphysiological doses. However, even with such doses of a performance nature, there is good news. Testosterone cypionate is merely testosterone. It's not a foreign substance to the body, and most men can tolerate fairly high levels if they supplement responsibly. The primary estrogenic side effects of testosterone cypionate include gynecomastia and excess water retention. This is caused by the testosterone hormone converting to estrogen through the aromatase enzyme, and when excess estrogen abounds, it can cause these effects. The advent of water retention can also promote high blood pressure if it gets out of hand. For this reason, an anti-estrogen is often recommended. If you can control water retention, a selective estrogen receptor modulator, or SERM, such as Nolvadex, is enough to protect from gynecomastia for a lot of men. However, many men will need an aromatase inhibitor such as Arimidex in order to control the estrogenic effects. It should be noted, aromatase inhibitors can have a strong negative impact on cholesterol, as can testosterone, and conjoined, this can cause a problem. SERMs cannot have this effect. In either case, it is imperative you live a healthy lifestyle that promotes the continuation of healthy cholesterol levels. This is very possible, but will require a healthy diet rich in omega fatty acids, as well as plenty of cardiovascular activity. Then we have the androgenic side effects of testosterone cypionate, which are caused by the testosterone hormone's ability to reduce to another androgen in the form of dihydrotestosterone via the 5-alpha reductase enzyme. This can promote acne, accelerated hair loss in those predisposed to male pattern baldness, and body hair growth. These effects are strongly dependent on genetics. Many men won't have a problem, but many men will also need to consider the use of a 5-alpha reductase inhibitor such as finasteride. The final side effect of testosterone cypionate is natural testosterone suppression. The body has no need to produce its own testosterone when supplementing with an exogenous form, and as a result, natural production will come to a halt. This is not a concern for the low testosterone patient. In this case, you're not producing the testosterone you need to begin with. For the performance-based individual, natural production will begin again once all exogenous hormones have cleared the body. However, this assumes no prior low testosterone condition existed and that no severe damage was done to the HPTA through improper supplementation practices. For those who have supplemented properly, a post-cycle therapy program following the steroid cycle will stimulate natural recovery, speed up the process, and promote a more efficient recovery. The standard testosterone cypionate dose for androgen deficiency treatment normally falls in the 100 to 200 mg every 7 to 14 day range. Some physicians may extend the time frame to 3 weeks, but this is very inefficient. In specific extreme cases, there are instances where 300 to 400 mg is applied every 7 to 14 days. For the performance athlete, 200 mg per week is quite common if the compound is being used to combat testosterone suppression caused by the use of other anabolic steroids. In a more direct performance sense, total doses will normally fall in the 400 to 600 mg per week range. Normally, such doses are split into 2 equal doses, such as 2 200 mg or 300 mg injections per week. Such doses are normally well within the realm of safety, and while some men can get away with more, understand higher doses will increase the risk. As for the total duration of use, testosterone cypionate can be used for the entire cycle. While many steroids can only be used for a portion of a cycle, testosterone cypionate can be safely used the entire duration and will stack well with all anabolic steroids. Testosterone cypionate can easily be purchased on the pharmaceutical market as well as the black market. However, if you want to buy testosterone cypionate on the black market, you will find it is not as commonly available as testosterone enanthate. There are numerous compounding facilities and pharmacies in the U.S. that continue to produce this compound. However, they are rarely found on the black market, and if they are, they will normally be counterfeits. When you buy testosterone cypionate, it is imperative you research your supplier as well as thoroughly understand the laws it pertains to where you live. Testosterone cypionate is a controlled substance in the U.S. and cannot be legally obtained without a prescription. Many countries carry very similar laws, but the U.S. is about as strict as it gets. For more information, please visit steroid.com, the world's most visited anabolic website.